Hi everyone, this is Exam 1 study guide. You want to make sure you're studying the following. Life expectancy, the controllable factors with regards to premature aging, and what factors with regards to your health are true in terms of lifestyle, absence of disease, and other dimensions of choices that you make in your life. Make sure you're studying the dimensions of wellness, intellectual health, psychological, physical, professional, and the other two. Sometimes there's three others when categorizing the dimensions of health. The leading causes of death in 15 to 24-year-olds. What is the Healthy Campus Initiative? Make sure you know that for Healthy People 2020. And which health issues affect college achievement the most? And which are the main three contributing factors? The most common health problem among students would be what? Most students describe their health as very good or fair or poor. Let me know what you come across there. And which of the following are true with regards to chronic illness? College students experience lower rates of chronic illness more than the regular population. Most college students meet the American Heart Association's recommendations for physical activity. The majority of students report being at a healthy weight, or college students often engage in behaviors that increase the risk of developing chronic disease. Which one of those do you think is the best answer? So that would be an example of one of your Exam 1 questions. Make sure you know about how students evaluate their peers with regards to the gateway drugs and the hard drugs. Infectious diseases, according to the CDC, is a concern in terms of what mode of transportation and how the disease is spread most easily. And which areas of the world contribute to the global public health efforts? Is it privately funded international health organizations, or the United Nations, or the World Health Organization, or is it a combination of all of them? What are the gender differences with regards to health outcomes in terms of specifically if men or women live longer? And with regards to socioeconomic, cultural, and biological differences, does that factor into health disparities among different ethnic groups? Who has the largest life expectancy in terms of specific Americans? Who is most likely to have cystic fibrosis in terms of which category of Americans? Which factors enable health behavior and which do not? And it's important to reward yourself when working on a behavior modification plan. Which is the best style of reward? Aversion therapy or rewarding, reinforcing, enabling? Which one is the best that you read in your textbook? What are the best strategies for successful behavior? What is important to look for when looking for health information online? What would not strengthen the validity and credibility of a scientific study? And what purpose do you feel college students most often take over-the-counter medications for? And what are the characteristics of over-the-counter medications in terms of use and misuse? Which supplementation is most popular by college students? Do you know the name of the symbol on a supplement that means the product meets minimum safety and purity standards? Is it .gov or FDA or UPS or USP? Which one is it? Which home health test would be taken at a clinic or hospital where on-site counseling is available? What are the different types of hair specialists and medical specialists, foot specialists, vision specialists, specialists that deal with children specifically? Make sure you know the different categories of doctors and beauticians. Conventional medicine can be referred to as what other type of name? The National Center for Complementary and Alternative Medicine places Chinese medicine under which category? Mind-body, manipulative and body-based, biologically based, or whole medical systems? What alternative medical treatments may involve all of the following, or none of the following, or some? Or which is the best answer in your opinion? Mind, energy, scientific method, or meditation? Make sure you know the different forms of alternative medicine with regards to what it's called when like cures like. In terms of healthcare, there's a lot of different types. Health maintenance organizations, PPOs, preferred provider organizations, point of service plans, mini medical plans, indemnity services, very specific health insurance plans. Make sure you know the different types: Medicare, Medi-Cal, Medicaid, flexible spending accounts, and make sure you know what your deductible is and what a deductible is. And if somebody turns 65, which public insurance plan would they use? What percentage of college students do not have insurance? What is a copay? What is it called that allows you to, after the age of 26, to extend your health care coverage under your parents' plan? Which of the following correctly lists the items from smallest to largest when we're talking about DNA, genome, chromosomes, and genes? When you spell out every part of your genome, what is this called? What are types of preventative dental care and which are not? What is the biggest challenge when aging? And which ethnicity are most likely to rate their health as excellent or good? If you were given choices to indicate what health conditions for older adults have not improved, what would be some examples of those? What's the best predictor of a decreased life expectancy? Think of the controllable factors with regards to diet and exercise, alcohol and drugs, taking into consideration family history. What is the life expectancy for men versus their female counterparts? What does social aging mean? What is the greatest contributing factor to age-related hearing loss? What is presbyopia in terms of one's vision? Which of the following nutrients may slow the progression of age-related macular degeneration with regards to your vision? Is it protein or fats or carbohydrates or vitamin C or zinc and antioxidants? Which one did you come across? What are some of the symptoms of premenopausal women? And what are they at greater risk for? Is an active sex life something that helps increase longevity? Which activities should you avoid if you have osteoarthritis? What puts women at a higher risk for osteoporosis? And what helps normal age-related changes in the brain in terms of activities? And the most severe age-related neurological disorder is what? What does Alzheimer's threaten and expose for those that have it? And how does it affect the families? Which lifestyle factors increase a person's risk for Alzheimer's? What is the highest rate of suicide in terms of which population? What is the best recommendation for a 65-year-old who wants to increase her physical activity? If somebody smokes a pack or two a day, what is the likelihood that they're going to live 2, 5, 10, or 25 years less than those that do not? What are the harmful effects of people that take prescription medications versus those that do not? And what happens if they combine this with other types of gateway drugs or supplements or over-the-counter medication? What's the best type of activity for somebody who has dementia? Which things can help the elderly who are dealing with cognitive decline? If you're talking about end-of-life situations, what following things should be covered with a healthcare proxy? What is a DNR? And what is a will? And how does hospice work? And who is it specifically targeted for? Make sure you take into consideration what to consider, when to or when not to stop treatment for somebody who's seriously ill. Make sure you inform family members of your decision if you're going to make an organ donation. What is a green burial? If people are socially isolated, how does that affect the grieving process? And that's the conclusion for your Examination 1 study guide. Best of luck.